My name is David Rennie. I'm a workforce consultant with Scottish Care. This presentation is an update on the workforce implications arising from the key health and social care policy drives that are currently in place. Up until March 2011, the Scottish Government funded Scottish Care to support capacity building in the independent social care workforce. Funding then stopped and has now been commenced again from the Scottish Government to Scottish Care for workforce development for 1 year from April 13 to March 14. Essentially, there are three agreed outcomes that the government have requested. First of all, that the project helps the government to understand the views and needs and capacity of providers going forward. So in a sense, the critical thing here is, what do the providers think and what are their views on a range of issues in relation to workforce? What do they tell the government are their needs, and what are their resource and capacity issues for the future in meeting these needs? The second of the outcomes is in relation to building capacity of the workforce in relation to the workforce skills, the workforce knowledge, the values, the development issues required in relation to meeting the policy of the government. And the third key outcome is supporting regulation, both the regulations of the Care Inspectorate in relation to services and the Social Services Council in relation to the workforce. What we're going to do here is go through the policy strands first and then the workforce implications from them next. And the key policy areas, of which there's a slide on these, are the integration of adult health and social care, which will be enacted or be implemented in March 2015, reshaping care for older people, which is currently in place and has a 10-year strategy to 2021, the Self-Directed Support Act, which became an act earlier in 2013 and will be implemented in April 2014, Scotland's National Dementia Strategy 2010, and we now have a Dementia Strategy 2013, the Care Inspectorate and the Care Inspectorate's regulation and the review of the National Care Standards, and the registration of the workforce by the Social Services Council. So first of all, the integration of adult health and social care, which is currently a bill. These on the screen are the key tenets of that. To create health and social care partnerships throughout Scotland. And these partnerships would work to nationally agreed outcomes across both what would be existing, the health boards and the local authorities. Joint and equal accountability of these two statutory partners going forward. Critically, in their key outcomes here would be strengthened role for the third and the independent sectors in both the design and planning stage and in the implementation and delivery of person-centred services. For the first time, we will have budgets, and we're talking here about adult health and social care. The budget will be an integrated budget. So one of the challenges we currently have is people moving between social services paid for through the local authority and into the health service, whether it's general practitioner primary care or whether it's into acute services or whatever. These budgets will now be integrated. And the key other principle here is that there will be a shift in the balance of care from institutional settings, which would be primarily evidenced through the health sector, and to community-based settings. Reshaping care for older people. This is a critical and the primary strategy in relation to the development and improvement of services and continuity and pathway of services for older people. Supporting people within their own homes or a homely setting is key to this. So in a sense it is shifting the balance to community-based settings. Homely settings would include care homes. In order to do this, each of the local authority areas, in conjunction with health sector, third and independent sector partners, have created joint strategic commissioning plans, which have got a 1-year, 3-year and 10-year scope. Key to all of this is ensuring that people do not go into hospital where they do not need to in relation to emergency or unplanned admissions, that they are, where possible, supported in the community. And also that currently where there is often bed blocking, there would be promotion of an appropriate and timely discharge back into the community. For these to happen, processes such as enablement, re-ablement, self-management have to be in place. And there also has to be appropriate support for conditions, long-term conditions, including dementia, palliative care, other disabilities and mental health. Within the care home or homely setting, the practice or process of step-up care, step-down, short breaks, intermediate care are all going to be developed going forward. Telehealth and telecare, particularly in rural settings, but of course not exclusively, are going to be key to the reshaping of older people. Two other final aspects which are important is that a good deal of the resource of the reshaping funds, which are around until 2015, are to support carers supporting their own family members in their own homes. Another one is the development of community capacity. There are a range, particularly of third sector organisations in the community, which can be harnessed to support people to live in their own home or homely setting for longer. In many ways, the shape of the way in which we care for and support people will be determined by the Self-Directed Support Act 2013. And currently, as at June 2013, there's a consultation on the regulations and guidance. The Act, to support this Act, and the Minister will determine these by September, October this year. The Act will be implemented in 2014, and critically it gives people 4 options: either to receive a funded direct payment for the services and the outcomes that have been agreed with them, that the person directs the funding through a third party, that the funding is controlled by the local authority who arrange the support, or a mix of the above. Choice and control is critical to the Self-Directed Support Act. In a sense, co-production and the involvement of the person is at the heart of the Act. There is a consultation also within the broader consultation on the place of residential care. On the Scottish Care website, there is the People as Partners website or portal, which gives a breakdown of the consultation on the statutory guidance and or statutory regulations and guidance. The dementia strategy. There are now 2 dementia strategies, 2010 to 13, and very recently dementia strategy 13 to 16, dementia strategy 2 in effect. The first of the dementia strategies set common dementia standards across health and social care. The dementia strategy essentially tries to provide an integrated support pathway with improved management of that pathway and consistent and robust outcome information. As of April 2013, there is now guaranteed post-diagnostic support for anyone who has been diagnosed with dementia. And in relation to the workforce, promoting excellence is a knowledge and skills framework which maps across and matches the outcomes of the dementia standards. We now have a dementia strategy 2013 to 16, And two of the aspects of this which are critical are the support for people in community and community settings are to be enhanced and worked on more closely and developed over the next 3 years. Overall, there are 17 commitments within this dementia strategy, and one of the key commitments, commitment 12, is in relation to improving service response, learning and development in care at home and care home services. Moving on now to the workforce development implications from the policy. In relation to integration, this is the integration of health and social care, adult health and social care services. So one of the implications is in relation to career pathways, because it will potentially enable people to travel across health, social care, across the statutory, independent and third sectors. In order to do this, there will likely need to be a core skill set for people working in the adult health and social care, with specific skill sets depending on the settings they're working in. For example, if I am a support worker working in a hospital theatre, or a support worker working in a care at home or housing support service, then my core skills essentially, which might be communication, health and safety, protection of adults, reflective skills and so on, might be the same, but my skill set for the practice that I would have to undertake in these different settings would be different. The likelihood is that there would be more common learning and development, reflected in the fact that, for example, common induction, common core skills and so on may be more apparent across the sectors, so it may be cost effective to have common learning and development. Another area where there might be more growth is, for example, in practice learning opportunities across the sectors. For example, allied health and allied health professionals, for example, occupational therapists, dietitians, physiotherapists, in their learning might more commonly have learning opportunities in social care settings, care homes, housing support, care home settings for their development. One of the reasons for this is that they're much more likely to be more connected to the community in the future as the balance of services changes. Reshaping care for older people. One of the issues we have here is that as we shift the balance from institutional care to care in the community, then there is going to be a requirement for greater numbers of people supporting people in their own homes or in a homely setting. And that will bring about, and it currently does, bring about challenges in respect of the recruitment and also issues with regard to retention of staff. In order to support people in their own homes, there will be a need for a range of skills and accountabilities in the workforce that are greater than those that currently exist in volume. These would include skills in relation to medication and infection. Also in the whole assessment and care planning process. Risk assessment is critical in that if we are to avoid emergency admissions and to support people in appropriate and early discharge from hospital, then there has to be suitable and robust risk assessments to enable these to occur. Communication skills, skills of enablement, reablement and self-management, skills in relation to advanced anticipatory care planning, and also, of course, knowledge and skills in relation to the accountabilities under adult protection. All of these are going to be critical if we're going to prepare a workforce which will support the reshaping of care for older people. Self-directed support. In many ways, the reshaping agenda is mirrored in the skills, knowledge and values which will be required by the workforce in relation to self-directed support. These will be, therefore, around risk enablement, critically how we view and support people in relation to person-centred and personalised work. Communication skills, as in reshaping care. Supporting people to exercise choice and control is an interesting one, in that it's not just about working with people in a person-centred way, it's about how to help them to feel to have the capacity and the confidence to assert themselves, to make choices, control and have control over their own needs and support and the outcomes that they wish for themselves. Adult protection, we've already said. Human rights is critical. The Self-Directed Support Act more focuses on human rights than in any other piece of health and social care legislation specifically, and it will require the workforce to understand what the accountabilities and what their roles are in relation to human rights. Similar to supporting individuals to exercise choice and control will be to help individuals to be involved and to be engaged, and that is not only the service users but the carers and family friends as well. The dementia strategy in relation to the workforce promoting excellence has a new 2013 to 2016 planned. In relation to what currently exists, the 2010 Promoting Excellence Plan delineated 4 levels of worker across health and social care: the informed level, the skilled level, the enhanced level and the expertise level. The level which I think is the most critical is in relation to skilled practice. Although it has not been directly levelled against Scottish vocational qualifications or what's called the Scottish Credit and Qualifications Framework, SCQF, it does in fact roughly equate to SVQ level 3. That does issues in relation to the current workforce, both in care homes and particularly in care at home services, where the base level of practice is at level 2. The skilled level is intended for all people who have direct contact with people who have dementia, their families and carers. So therefore, going forward, the Scottish Government will have to make decisions in relation to what levels it requires of the workforce to be competent in relation to working with people who have dementia. The informed level is for everybody who comes into contact with people who have dementia, and that may be, for example, ancillary staff, catering staff and others in care homes, and staff who, reception staff and a range of others in other settings. It could include office staff in care at home services who may be on the phone to people who have dementia, and so it's important that all of these people are informed. Enhanced and expertise level relates to other people who come into contact with people but who require greater accountabilities and skills. Champions and ambassadors is a model that has been rolled out across health and social care. Champions has been focusing currently on the acute sector, and ambassadors primarily, well, has also been in the acute sector, but also for care at home and care home services. The ambassador model is a particularly good one. It's a 2-day programme, and beyond that programme it supports ambassadors in social care settings to act as conduits for the knowledge and skills and the learning programmes and the legislation around dementia. There is a need for care homes, care at home and housing support services to plan in relation to how they improve their services and their workforce in relation to dementia, and these are some of the areas: communication, post-diagnosis support, palliative care, psychological therapies and cognitive stimulation. These are areas that social care services will need to consider in terms of improving the skills of the workforce, and these are programmes that currently exist. Leadership is a cross-cutting area of development which will require skills in the future. The Scottish Social Services Council on their website have all the details that are contained within this slide. They have a leadership and management strategy. The Social Services Council view all staff as having leadership capacity, whether it is a care at home worker who visits people in their own homes, or a care at home support worker. It is viewed that all individuals should be promoted in developing their leadership skills, even if they're not specifically managing other individuals. These are important skills to develop. The Social Services Council website has a portal called Step Into Leadership, and it very specifically and very accessibly enables individuals at all levels to look at what might suit them and what might be in their best interest in relation to how to develop leadership skills. There's also a range of other programmes, including in relation to, there is a national leadership programme, there are action learning programmes, there's support for coaching and mentoring, there's succession planning, and a range of other programmes and events and processes in place to support leadership in Scotland. Another cross-cutting area is known as knowledge into practice. The question really is, how do staff, managers and others get and acquire information, and then what do they do with it? So first of all, where do they get it? Do they get it from the Social Services Council websites, or other processes, from the Care Inspectorate, from Institute of Research and Innovation and Social Services, from the Social Services Knowledge Scotland website, from Workforce Matters? Where do they get information, and then how is that transferred and how is that put into practice? More and more of our practice and government policies and good practice guidelines are being developed on what's called evidence-informed practice. And that really is looking around the world and looking locally at what works, and trying to translate that into your own practice so that it's based on good information on what works elsewhere. Another area that we're looking at, particularly in social services, health and social services in Scotland, is how we use innovative practice. Last year, a range of bodies drew together people to ask them for ideas and innovatory thoughts on how we could improve our services. That was whittled down into 5 specific projects that have been taken forward, and one of them, for example, is called Dementia Diary. What that is, it's not dissimilar to a life storybook, but what happens is that when a person, or what the plan would be, is that when a person has been diagnosed with dementia, at an appropriate time and in an appropriate way, they're encouraged to reflect on their life and who they currently are in any format that suits them, whether that's a digital story through video, whether it's a book, whether it is whatever. But what that would then do is that it would go with them through their journey through dementia and into any support services which are around during that period. For example, if a person goes into a care home, it would enable the staff of that care home to have a much better picture of who that person is and has been, rather than in the condition and level of dementia that they find themselves in at that point in time. Workforce Matters through Scottish Care is currently engaged in a project looking at how services acquire information, transfer it and put it into practice with an outcome to try and improve that process. Regulation. We are discussing with the Care Inspectorate issues about the workforce implications from the inspection function, including areas such as recruitment and training plans. We're also closely involved with the Scottish Social Services Council in terms of their process and their ongoing process of registration of staff, of the conduct of staff, of continuing professional development. Also, as the national occupational standards are adjusted and changed and are developed, and other consultations around the workforce, then Workforce Matters will be closely involved with providers in acting as a conduit and in supporting consultations. Scottish Care, through Workforce Matters and through the government funding, has set up a workforce development reference group. That reference group will meet to discuss issues around where we are being consulted on areas of practice in relation to workforce, where we're being asked to give advice, where we're being asked to represent the sector, where there is pilot or project work in place. We have set up a number of smaller topic joint working groups, and I will talk about that next. And we will support whatever events we think would be purposeful in helping the sector to understand and grow workforce development issues and grow capacity. The joint working groups that I mentioned are in relation to self-directed support, integration, dementia, leadership, knowledge into practice, and clinical activities. For example, there's a range of areas that social care staff will need to develop. I've mentioned 2: infection control, medication, falls, and a range of others, that it would be helpful to have people from the sector, providers from the sector, who have skills in that, coming forward to work with us in helping to develop these clinical areas and to support dissemination of that to the workforce. So what we're looking for is interest from providers in relation to these joint working groups that we have, largely with the Scottish Social Services Council, to take providers, a small number of providers who contribute to these working groups, through a journey of development in these skills areas, and also in relation to disseminating the good practice to the wider workforce. So we are interested in, if anybody is interested in joining any of these joint working groups, to come forward. If you do wish to contribute to these, then please contact myself, David Rennie, at the phone number or the email address there. Or also please look at the Workforce Matters website at workforcematters.co.uk. That website will give you all of this information. It will update you weekly and monthly by news flashes. If you are interested in getting these monthly news flashes, if you don't already, then please go on to the website and sign up to the mailing list. Thank you for listening.